This webinar will focus on the health resources available to us in GoWYLD. From the GoWYLD databases page, you'll see that we have subject area breakdowns, and I'm going to click on Health and Medicine for today's webinar. We have quite a variety as I scroll down from Alt Health Watch, which provides information on complementary, holistic, and integrated approaches to healthcare. A very sophisticated evidence-based medicine database called Cochrane Library. A couple we'll visit today: Health and Wellness Resource Center, Health Source Consumer Education. We have a couple of nursing databases: Health Source Nursing Academic, Nursing and Allied Health Collection, as well as the Nursing Resource Center. One database with Spanish language medical research, Medic Latina. A broad database that we'll start with, MedlinePlus, and as we scroll to the bottom, ProQuest Central and access to PubMed. I'm going to begin today with the MedlinePlus. This resource comes from the National Library of Medicine and National Institute of Health. As you can see on the main page, we have a search box at the top, but through the center we have access to health topics, drugs and supplements, and videos and cool tools. Down the center there's a section about your health. Notice that there are tabs. There's a general topic one, so you can see things about back pain, high blood pressure, but there's also a tab for seniors, so health information related to seniors specifically, or women, children, or men. On the right-hand side, they switch it around and include health news. And on the left-hand side, you have a link to a medical dictionary, and they always feature a site. We're going to start here in the middle about your health, since we're talking about New Year's resolutions and getting to accurate health information. I'm going to select, under the general information, exercise and physical fitness. When you get onto this page, all of the MedlinePlus pages will have a similar feel. You'll get a nice description at the top, and as you scroll down, they always give some links for Start Here. You'll notice that under the description there is Get Exercise and Physical Fitness Updates by Email. You can enter your email address in, but right next to it, if you want to know more about that, you click on What's This? And it tells you about the email alerts that they can send you. Then below that, there's a table, and all of the resources in MedlinePlus will give you this table, providing you links to basic information, where you can go to learn more, if they've got multimedia, their reference shelf, and research. These link down to lower parts of the page, and here you'll see all of the different agencies and organizations providing information. So we've got the President's Council on Fitness and Sports, and as you scroll down farther, information from the Mayo Foundation. You'll also find here American Academy of Orthopedic Surgeons and more. So you'll feel really good about pointing your patrons to this information. In this selection here, I'm going to click on the Health Check Tools, because I think these will be some places where people want to go as they're working on their New Year's resolutions. You'll see that there's a Choose My Plate, how many calories will exercises burn, a super tracker for food, and target heart rate. So here's where they can actually go to tools to use for getting in shape. When I click on one of those, you'll see that we go outside of MedlinePlus to the actual agency or organization providing that information. And it does open in a separate window. You can close that and come right back into MedlinePlus. I could go back up to my table, but you can see as we scroll down, there's access to tutorials. Under tutorials, you'll see that there's one called Exercising for a Healthy Life, and you'll see that it's also available in Spanish. Many of these items on this particular database are provided in Spanish. You'll also see as you go through this database and do some searching that there are also items in easy to read, and you can turn the page into other languages. And I'm going to go back up to the top again. And you'll see that there's information like we saw on the main page specifically for women. And there are patient handouts, which I think will be really useful for folks coming into these patient handouts and getting how to take your heart rate doing physical activity. So a lot of information here, both on providing health information or supporting folks as they launch into their New Year's resolutions. I'm going to go back to the main page, but you saw that I could also click on the different tabs. They come with me as I do go into different pages. In addition to using these links right here in the center of the page, I can go straight into health topics. I can go into topics by letter of the alphabet, so I could just click on a letter here and it gives me an alphabetic list to choose from. Below the alphabet, I have health topics that they've broadened into specific areas of the body or conditions or demographic groups, and they've also done it by health and wellness. So I think these categories can really help folks get to what they're looking for without scrolling through a big alphabetic list. So again, we could go into fitness and exercise, food and nutrition there under health and wellness. I can look at demographic groups like we saw on the main page and look at broad categories for disorders, conditions, and body locations. If I click on body location, for example, bones, joints, and muscles, in addition to what we saw when we looked at the exercise and fitness one, they've added the skeleton. So they're pointing out things, pieces of anatomy. And on the right of that, we can select one. So we could go right to spine, for example, and then it opens up the various topics under the spine. If we scroll down, you'll see under bones, joints, muscles, there are topics, alphabetic. And within this database, they also do a C also. So if you've looked at one aseptic necrosis, it tells you what term to look up in this particular database. If I go back to my health topics here, I can look at other particular parts, and what you'll find on all of these is they'll include, just like we saw with the exercise and fitness, once you go into a specific topic, you'll have research pages, you'll have in the news, you'll have where to get started for information, you'll have videos if available, so a broad range of information here. I can go back out to the main page like we did before, or notice my tabs came along with us. I'm going to go to the video and cool tools here. So in addition to just getting information about the topic, they've also provided interactive tutorials on all of these particular topics, which would be really good if you've got someone going in for a colonoscopy and we scroll down, or for a surgery procedure, they can go in and get some background about what they're going to be facing. There's also anatomy videos, which might be really useful for your students and your college students coming in, and folks just getting a better idea of what it has to do with, for example, if they're suffering from macular degeneration, need some more information about that, they can open up the anatomy video for that. And there are also very graphic surgery videos. These are pre-recorded webcasts of surgical procedures. They're actual operations. So if there's some interest there, here's all the categories for that. And that's under your video and cool tools. Also on that page on the right-hand side, there are calculators, quizzes, and games. So if you're doing some sort of programming for seniors or programming for kids in your library on particular health issues, here's some other things to point folks to. There's also understanding medical words and evaluating health information. So again, other tutorials that they're providing that if you're working with schools or doing program can be very helpful. Notice at the top right, you can also click on Spanish and get the information that they provide in Spanish. And that's all under the video and cool tools. So now let's take a look at the middle tab. In addition to health topics and all this supplemental video information and calculators and tools, you can also look up drugs and herbal supplements. This is really nice because you can do prescription drugs, over-the-counter medicines, and various herbal supplements, and you can browse by generic or brand name here. So we can just do a little alphabetic link and scroll the list. Then if you select one of those, all of them will give you this particular information: why it's prescribed, how it's used, what side effects, things like that, and all in the same order. And this table of contents is linked down into the main body of the information. And you'll find that for each one of the drugs listed in this database. If you don't want to go through the alphabetic list and scroll, you can search MedlinePlus at the top in the search box, and it will give you links to articles, information, and the drug information. So I've done my search, and on Ativan, it brought up lorazepam, and what it's giving me is if I had a generic name or used in the US name, it's going to bring that up. So if I click on brand names, you'll see that I typed in Ativan, but it brought up the lorazepam. So you'll get both, and it'll bring up the page for that. So you can use that search box here at the top in addition to the alphabetic list. If you're looking at the herbs and supplements, I can go to the All Herbs and Supplement link. Click on one of the herbs and supplements. You'll see it's a little different because it's bringing it to you from the National Center for Complementary and Alternative Medicine. It gives information about it, and the addition on here, which is really nice on the herbals, is it has a link to what the science says. So here's information about studies that have been done, getting some scientific background for that herbal supplement. And that opens up in a separate window again, and we can come back to the main page. I'm going to go back to our home page here. So in addition to our tabs here, the information down the center, at the top there's an FAQ. If you wanted to know more about what is MedlinePlus, how to cite these pages, how long it's updated, that information is there under the FAQ. There's also an About MedlinePlus to get some details about this particular database. This one I find is a very easy to use, broad category resource for your patrons. We're going to move on to some other resources now under health and medicine. The next one I want to show you is another one similar to MedlinePlus, and that's the Health and Wellness Resource Center. This one is one of our GoWYLD databases. You'll see it's kind of similar to MedlinePlus. I've got my tabs that I can go in. Rather than health topics, it's called diseases and conditions. I do have a tab to look up drugs. There is a medical dictionary. Like we saw in MedlinePlus, it also brings these searches out onto the main page. The first one listed is they bring some categories out for diseases and conditions. There's also a Find a Drug, where you can search not only the drug name, but you can search by symptoms. There's also a directory here that lets you search for service agencies, for example, Medicaid information and health product providers. On the right-hand side here, you'll find a search box that you can search by keyword, subject, or words in the entire document. You can also search for only full-text articles, consumer health information, items in Spanish, and they too provide topics in the news. In the green band across the top, there is a help button as well as search tips. This helps you search within the database and how to use, whether you use capitalization, punctuation, how to do date ranges. The help box gets you to a table of contents of information about Health and Wellness Resource Center. So if you wanted to know more about the diseases and conditions page, what they're looking for, if you wanted to know what the directories were searching for, or if we wanted to know about drugs and herbal remedies, this tells you where it's finding that information. So where it's getting the information it's bringing to those pages. Okay, so let's take a look at one of the diseases and conditions. I'm going to click on the tab. Notice I get an alphabetic list, so I'm going to scroll over to the M's here and select macular degeneration. All of the pages that you pull up in Health and Wellness Resource Center will look like this. You've got a little source citation at the top, a linked table of contents, definition and description, and then you move down into causes and symptoms, diagnosis, and we can link down into that section of the information page. At the top on the left, you'll see that there are print, email, download buttons and viewing the PDF. If I click on the View PDF, you can also print the PDF page out of that particular image. And I can close that because it opens in a separate window. I'm going to go back to our tab and select another one just to show the layout of these pages. So I select the P and I'm going to just scroll down here to Parkinson's, and you can see again the same layout. You've always got your source citation at the top. We've got our linked table of contents. It also has a See Also on the left hand side. If I were to click on the Parkinson's disease under See Also, what it's going to do is take me farther into the resource. Now I can link to fact sheets, magazines and journal articles, drug information, pamphlets, if videos are available, and news items. And you can see, so now I've opened it up to a whole lot of information beyond just my information page there on the main alphabetic listing. And that was just using my alphabetic link. I go into the disease or condition, and the See Also was on the left-hand side. I'm going to click on the Drug tab. Like we saw in MedlinePlus, I can put the name of a drug in. And again, it will bring up a list, and notice that it will bring up brand names or the generic name or the company drug name. And they'll do drug overviews just like we saw in MedlinePlus. So both provide this background information about the drug, if doses are missed, side effects, and things like that. We also have a dictionary in this one. And it gives you just the definition there. Also, when you go into the dictionary, you also get the See Also. So once I've looked up my term, I've got the proper spelling, I can do the See Also, and again, it brings me into accessing fact sheets, articles, pamphlet information. We can use the search box as well. And it brings up my fact sheets and magazine articles. So you can come at it through the tabs for diseases and conditions, the drugs, the directories, the dictionaries, or using the search box, all to get at this information and a lot of background. So you can get the general information pages and then go deeper into the articles, fact sheets, and videos. Using Health and Wellness Resource Center as well as MedlinePlus gives easy, reliable resources for your patrons and a great place to start. I'm going to go back to our health and medicine page on GoWYLD, and we'll go into some more specific databases. For example, I'm going to go into Health Source Consumer. This particular one is from EBSCO. So rather than providing information pages, pamphlets under topics, this is a searchable database. Notice that I can use my search box here. There is advanced search. If I scroll down to search options, I can do the Boolean phrase so that it looks at my and, or I don't have to put it in quotes. And you can do the or search terms here, finding any or all. You can also click on full text, but I hesitate to have you do that because we have so many resources, and I'll show you the link there. What you might want to use, however, is here on the left where it says also search within the full text of articles. So if you have too narrow a search, you can always come back, click on that, and it will broaden where it's looking for your search terms. So I'm going to type in a search New Year's resolutions, since that's what we're talking about here this January. And it brings up my articles in Health Source. The EBSCO databases are all arranged this way. Your results down the center. You do have the preview icon next to the title. If you hover your cursor over that, rather than having to go into each record individually, you hover over the preview icon, it will pop up the abstract information. Then you can see if it's something you want to go in and look at. You'll also see within that box it tells you if it's in full text. In this case, it's available in HTML full text. The second one down, if I were to do that, you'll see in the box it tells me I have also a PDF full text. And that link is also on the main page. You'll also notice that the great publication variety going into Health Source Consumer Edition. To see those without just looking at the citation information, on the left-hand side, you have a link you can click on to publication. There's also show more. So this is part of the variety of the publications within my results. There's also one for subjects, so I have 117 results, and I can narrow by some of these subjects by selecting one of these items and clicking on update. Let's just select one of these articles. On the right-hand side, there's your print, email, and save. You can also get your citation information. Go back to my results list here at the top of the blue bar. So I'm going to go back to our main page here. I can either clear my search box or just click on the EBSCO host button to come out to the main page. The other thing available here at the very top is the publications link. This brings up alphabetically all the publications that are in this particular database. So if you wanted to see what it includes, or you wanted to look through a particular issue of a magazine, I'm going to click on the P and go into parenting. When you do that in an EBSCO database, it gives you information about it, how far back it's in full text, so December 1997 to 2008. You'll see on the right-hand side those years listed. If I click on the year 2008, for example, it opens up all the different issues. I can click on an issue, and now I can browse through all the articles in the issue of that particular magazine or journal. The other thing I can do when I've clicked on the Publications tab and selected a publication, above the years that are available, it says search within this publication. If I click on that, now I know that parenting is included in this particular database. It brings the journal Parenting into my search box. I just do a Boolean and add my search terms. And it'll bring up my articles. So in Parenting Magazine, here are the articles on toddlers screaming. If you've got one, for example, this third one that is not in full text, there's the link I mentioned before that you can check full text availability in our e-journals, and you can look to see we own parenting and all these other resources, but do check the years. That was a February 1997, and this one starts in October of 97. But it does let you look to see if we own it somewhere else in full text. And that opens in a separate window, and I just close that out. So that's here on the left-hand side. Here above the search box, it says choose databases. If I open that up, here's the databases that we have from EBSCO. So if you wanted to do your health search in multiple resources in EBSCO, for example, Master File, Health Source Consumer, and Alt Health Watch, I check those boxes and say OK. It brings me back to my search box. If you want to see all that you're searching, click Show All right above my search box, and it lists the ones I'm looking at. So now if I launch my search, for example, on yoga, it will search all three of those resources at once, and I have a lot of hits here. So I have 17,000 hits. What I can do is scroll down, and you'll see in addition to the subject and publication that we saw before, it lists the databases that I've selected and how many hits I got in each one of those. so you can see if you wanted to go to just a specific one of those databases, I can check the box and update and narrow my search. I can also narrow my search by using the subject and publication. So if I wanted to look at just yoga postures, I can check that box, update my hits, and now I have 448 results. If I wanted to narrow again, I can select another subject or I can select a publication. So let's say I wanted to do it just in Yoga Journal and I update. Notice at the top now, in my breadcrumbs box, I have yoga postures, what I narrowed, and yoga journal. And I'm down to 273 results. And I have those results down the center. If you've overshot or you want to go back and look at yoga postures and other things, there's a checkbox to the left of each one of those. If I click on that, it will take that narrowing off and go back up through my narrowed results. So those are a look at a few of the EBSCOs and one of the GoWYLD databases. Let's go back into our health and medicine resources and take a peek quickly at just a few others that might be of interest to you. We do have some resources if you're working with nursing students or nurses and healthcare providers. We have the Health Reference Center Academic. We have Health Source for Nursing and Academic. Nursing and Allied Health Collection for professionals and students working on their nursing focused curriculum, as it states there. And Nursing Resource Center. This one might be of interest to more than just nursing students because it's, as they point out here, easy to use interface on disease and drug overviews. It includes care plans, journals, animated anatomy and physiology diagrams, as well as all of your background encyclopedias and journal resources. You'll see it is a GoWYLD database. In addition to our searching capabilities, across the top here there is a nursing toolbox. They also have the NIC and OC, and if I click on one of those, you'll see that if you're working with students, here's the nursing intervention classifications. So a lot of other information here for those nursing students and those practitioners. If I do a search, we'll look at one we've searched in other databases, neuropathy again, you'll see that I've got tabs across the top here. So in addition to journal articles, I have that disease and conditions information out of the encyclopedias. I can go into assessment information, diagnostics, intervention, drugs, and they're opening up under these particular tabs. On the left-hand side, they have the See Alsos as well. So if we did neuropathy, we can also look over here under subject terms for peripheral neuropathy. It gives me my See Also, and again, I can open that up. You'll notice that not all the tabs are highlighted. This indicates what information is available under peripheral neuropathy. And these tabs just do not highlight because there's no information there. I can go back and do a basic search. There is also advanced searching here and subject guide searching, as well as a publication search like we saw in our other ones. If you want to just list them like we had the publication tabs in EBSCO, just click on List All and it will bring up an alphabetic list. Coming back into our health and medicine, a couple quick other ones here. If I scroll down, I'm going to take a quick look here at ProQuest Central. ProQuest Central is a huge database covering a lot of subjects. When you bring it up, there's a basic search box and it lists multiple databases here. If you click on the drop-down menu, you'll see that it's everything from business to historical newspapers here. What I want to focus on is the medical sciences here in the center. If you want to select multiple databases, you can click on that here to the right of that box. But I'm just going to select ProQuest Family Health just to take a look at this particular database. So I'm going to click on or search teen and body image in the ProQuest Family Health. And again, like we've seen before, we have the tabs at the top. So I can go just to the scholarly journals, just to the magazines. I can go to just the trade publications here under ProQuest Family Health. So I've got Obesity and Diabetes Week, Fitness and Wellness Week, Life Science Weekly, Health and Medicine Week. I go into one of the articles, and you'll see that they do the abstract summary at the top. Scroll down, and it was just a short little article, and there's the text of my article. I can print, email, and copy this link if I'm going to place it into another document, and I can go back to my results here at the top. Notice too that they have suggested topics at the top, so I can launch a new search from this particular one. So if you get a chance, come in and take a look at ProQuest Central, not just for health, but remember the drop-down menu if you're looking for these particular items that we have covered in this database. In addition to the ones in English, there is a small database, Medic Latina, with 100 Spanish language medical research journals. Search is the same way, EBSCO database, so you have all the same searching. You also have the publications tab at the top if you needed to see what was available or working with a patron on what might be available in this database. In addition to the Spanish language, there are also Spanish editions of, for example, the American Journal of Psychiatry. And like we saw before, it tells how far back we have full text, and you can browse particular issues of this particular resource. I'm going to go back to our health and medicine page. You'll see that there's a lot of other resources we didn't look at, but because many of them are EBSCO or many of them are Gale, you'll get a feel for how these are searching, and that will give you some idea when you're directing patrons or students to those resources. So whether you're looking for resources for New Year's resolutions, you're offering programs for seniors or teens, helping students with their research, or guiding your patrons to reliable information, I think you'll see that we have many tools that would become your go-to health resources here on the GoWYLD databases.